to decrease the physical symptoms of stenosis, and how to actually work towards improving the correction of the size of the tightness when it comes to stenosis is the subject of this video, so stay tuned. Hey, I'm Dr. Shaki from Irvine Spinal Wellness Center, your Irvine Posture, Movement, and Chiropractic Clinic. Unfortunately, we're seeing more and more people with stenosis, either cervical, thoracic, or lumbar. Thoracic spine, mid-back is not common, but in the neck and lower back, they're actually a lot more common than we realize. While stenosis can be something you're born with, it becomes more of a problem later on in life, and some of the symptoms have to do with, depending on the location, if it's in the upper area or lower area, it can actually cause radiation and pain down the arms, etc., etc. I've done a blog on that. We're going to make sure we put that in the description box so you can refer to it for both cervical and lumbar. And I've also done a whole video on the subject of stenosis and what that is. So we'll make sure we put that video at the end of this one. The focus of this video, however, is to see what we can do to minimize the physical symptoms as you're making the correction. It has to do with the correction of this rectangle. We're going to put a video at the end of this video that I just did on the whole stabilization and lower and upper extremity correlation that we'll make sure we put at the end of this video as well. So in the rectangular positioning of the body, as we're referring to, it's important to keep that in a neutral spine, meaning there is no curvature that way or opposite this way. So the correction has to come when there is a improvement in posture by keeping the neutrality here. To keep the neutrality, you need to engage the pelvic diaphragm, abdominal diaphragm. Both of them are shifted and on top of each other, parallel to each other. So your hip is in front. You're going to move the hip back so it lines up with the outside bump of your ankle. So if you're this way, you're not going to grab the top to pull you back. You're going to hip hinge back and then engage your pelvic diaphragm like so, which is here, and slowly move the body one vertebra at a time in your head towards the back. It's much more difficult in action than I'm doing, and the reason I'm better at it is because I do this quite often. So in the process of that shifting of vertebra from one position to the next and shifting your center of gravity to closer to where it needs to be, the load on the vertebra and the load on the part of the vertebrae when the nerve comes out where that stenosis is. So imagine there's a hole and there's a nerve that comes through that hole, and now we're focusing on that. As the position of vertebra over the one below and above changes, the shape and integrity of this hole changes. It minimizes the inflammation. It minimizes the inflammation that actually impacts the size of this hole and the integrity of the connective tissue within that hole. Everything as gets inflamed and thickened decreases the sizes more and more. So if I'm working on improving my posture, I take away some of the reasons why inflammation is taking place. So there's a decrease right there. While the thickening of connective tissue that has taken place up to this point is not going to go away, I'm preventing it from getting thicker. So this is how you end up decreasing your symptomology, and you're decreasing the chances of this size hole to get smaller while you're working on improving everything else that plays a role on the impact, negative impact on this injured body part. that was a little bit complicated. It's that some of these videos are a little more advanced than basic. So in order for you to bring yourself up to par, I suggest you watch some of these videos I've done on the subject. All you have to do is just search in my channel for the specifics, let's say stenosis, and then you see the list of things that pop up. Watch it. If you have any questions, make sure you contact me using one of the methods of contact in the description box. Subscribe to the channel and make an appointment if you think you need a little extra help. Until next time, take care.